In today's video, we are going to talk about an easiest yet complex topic of mental health nursing, that is classification of mental disorders. We have a lot of classifications present in our books, but there are mostly two main classifications that work throughout the world. Apart from that, Indian system of classification is also what we can use in India. Classification is a process by which complex phenomena are organized into categories, classes, or ranks, so as to bring together those things that most resemble each other and to separate those that differ. And now, at present, there are two major classifications in psychiatry, namely ICD-10 that has been discovered in 1992 and DSM-5 which has been discovered in 2013. Before DSM-5, there were DSM-4 and others. In both ICD and DSM, the mental disorders are at present grouped by their symptoms in categories that compose the classification. Moving towards the first, that is ICD-10. ICD stand for International Statistical Classification of Disease and Related Health Problems. This is WHO's classification for all diseases and related health problems. The chapter F classifies psychiatric disorder as mental and behavioral disorder and codes them on an alphanumerical system from F00 to F99. The main categories in ICD-10 will be discussed one by one. First one is F00 to F09, which constitutes organic mental disorders. In this, there can be dementia, delirium, organic amnestic syndrome. Then there is F10 to F19, which constitutes mental and behavioral disorders due to psychoactive substance, like alcohol dependence syndrome or other substance abuse disorders. Then there is F20 to F29, which has schizophrenia, schizotypal disorder, or delusional disorders. Then there is F30 to F39, which constitutes mood or affective disorders, which has manic episodes, depressive episodes, bipolar disorders, persistent mood disorders. Then there is F40 to F48. It constitutes neurotic, stress-related, and somatoform disorder. It has phobia, panic, and generalized anxiety disorders. Apart from that, obsessive-compulsive disorder also comes under this classification. Then there is F50 to F59, which constitutes behavioral syndrome associated with physiological disturbance. In this, we can keep tremors, unspecified muscle twitching, anorexia nervosa, bulimia nervosa. Then comes F60 to F69, disorders of adult personality and behavior, specific personality disorder, paranoid personality disorder, histrionic personality disorder, gender identity disorder, disorders of sexual preferences. These are all which comes under F60 to F69. Then there is F70 to F79, which has mental retardation. And then comes F80 to F89, disorders of psychological development. It constitutes childhood autism. Then one more, that is F90 to F98, which has behavioral and emotional disorders with onset usually occurring in childhood and adolescence. In this, there can be hyperkinetic disorders, conduct disorder, sibling rivalry disorder. Then the last one in ICD-10 is F99, unspecified mental disorders. So this is the classification given by ICD-10 from F00 to F09. Now moving towards another classification system that's given by DSM-5, the Diagnostic and Statistical Manual of Mental Disorder, the 5th edition, published on 18th of May 2013. In the United States, the DSM serves as a universal authority for psychiatric disorders. Treatment recommendations as well as payment by healthcare providers are often determined by DSM classifications. So the appearance of new version has significant practical importance. And according to DSM-5, there are some codes given to the diagnostic criteria of mental disorders. The first one is 1.2.1, which constitutes neurodevelopmental disorders. Then 1.2.2, which has schizophrenia spectrum and other psychotic disorders. Then there is 1.2.3, bipolar and related disorders. Then there is 1.2.4, that is depressive disorders. Then there is 1.2.5, anxiety disorders. 1.2.6, obsessive compulsive and related disorders. 1.2.7 is trauma and stressor related disorders. 1.2.8, dissociative disorders. 1.2.9, somatic symptoms and related disorders. 1.2.10, feeding and eating disorder. 1.2.11, sleep-wake disorder. 1.2.12, sexual dysfunctions. 1.2.13, gender dysphoria. 1.2.14, disruptive impulse control and conduct disorder. 1.2.15, substance-related and addictive disorders. 1.2.16, neurocognitive disorders. 1.2.17, paraphilic disorders. 1.2.18, personality disorders. These all codes are used for different diagnostic criteria on the basis of set of symptoms present in different mental health disorders given by DSM-5. Now we will talk about the Indian classification. In India, Nicky, Wig and Singer, they attempted some modifications of ICD-8 to suit Indian conditions. And they are broadly grouped in 3 main classes: psychosis, neurosis and special disorders. Now we will see what comes under psychosis. There is the functional disorders. It constitutes schizophrenia. Then there is affective disorders. It constitutes mania and depression. Then there is organic disorders. It constitutes acute organic mental disorder and chronic organic mental disorders. Now we will move towards the second classification, that is neurosis, which comes under Indian classification. In neurosis, there is anxiety neurosis, depressive neurosis, hysterical neurosis, obsessive compulsive neurosis, and phobia neurosis. The one more class under Indian classification is special disorders. It has childhood disorder, which constitutes conduct disorders and emotional disorders. The other one is personality disorders, which constitute sociopath and psychopaths. Then there is substance abuse, which constitutes alcohol abuse and drug abuse. Then there is psychophysiological disorders, which constitutes asthma and psoriasis. Then there is one more, that is mental retardation, which can be mild, moderate, severe, or profound. So, this was all about the classification of mental disorders according to ICD-10, DSM-5, and Indian classification system. Thank you very much. Stay tuned with Nursing World and follow me on Instagram with the name of Nursing World 21. And if you are not yet a subscriber, please go and click on the subscriber button. Thank you.